Hi everybody, I'm Mike. This is Kyle. Thank you for participating today, Kyle. So today we're going to be testing Kyle's range of motion for dorsiflexion at his talocrural joint, otherwise known as his ankle joint, and we're going to be using a goniometer. Now, while doing this, we have to be mindful of his gastrocnemius, which is his larger calf muscle, because in full knee extension, that gastrocnemius the muscle belly will stretch out and create tension at the Achilles, and it'll make it more difficult for dorsiflexion to occur, especially because the gastrocnemius function at the ankle is to produce plantar flexion. So to avoid the complications of the gastrocnemius, we're going to have Kyle lay down on his stomach with his knees flexed and his feet facing the ceiling, the bottom of his feet facing towards the ceiling, to loosen the gastrocnemius muscle and release any possible tension so that the anterior dorsiflexor muscles can facilitate dorsiflexion to the greatest range of motion possible with the least possible resistance from the gastrocnemius. So what I'm going to do is I'm going to use the circular axis, and I'm going to place the point along the middle of that right on his lateral malleolus, right here. I'm going to point the stationary non-moving arm towards his fibular head, which is protrusion, distal and lateral to his knee. And then once I have that, I'm going to hold that in place so I don't lose the angle. And I'm going to ask him to dorsiflex his foot. So now that this black line is parallel to his fifth metatarsal, which is this bone that I'm pointing to with my index finger, once that's parallel, I'll have my angle. And I'll just hold it in place. It's around 75 degrees. The ankle is neutral at 90 degrees, so we're going to use this angle and subtract it from 90. That gives us 15 degrees range of motion for dorsiflexion, which is within the normal range of within the standard normal range of good dorsiflexion range of motion. But he can still do exercises to improve or maintain that range of motion. Now we're just going to check the other side to make sure there's no imbalances. Lateral malleolus, fibular head, stationary arm pointing towards it if you want to dorsiflex. Parallel, 70 degrees, 20 minus 70, or 90 minus 70 is 20 degrees range of motion, so no real imbalance there. He has good range of motion, but he can still do corrective exercises. Okay, so the first corrective exercise we're going to do is the banded talus distraction, while Kyle's ground contact foot is going to have all of 5 toes in extension, and his right foot, which is elevated, is going to be flat, and I'm going to hold the band to hold the talus back as he pushes himself into dorsiflexion, and the talus is going to move posteriorly instead of anteriorly, and it's going to allow for the tibia and the fibula to hinge at that talus more, to allow greater range of motion for dorsiflexion. And a good way to get results for this is to do intervals of 30 until you reach 2 minutes. Do this twice a day for 2 consecutive weeks to get results. So the last corrective exercise we're going to have Kyle do is the anterior compartment mobilization, and this will hopefully massage the tissues and the tendons that assist in dorsiflexing his ankle. So over time through this exercise, it will release the tension in these tendons, allowing for less resistance when dorsiflexing while using his anterior dorsiflexor muscles on his lower leg. So we're going to have him start by putting the tennis ball just distal to the knee on the surrounding tissue, just lateral on his lateral shin. And we're going to start with the neutral foot position. And I'm going to have him plantar flex his ankle to rotate the ball and dorsiflex back. And that's going to massage his tendons right here. And doing this 2 times a day for 2 minutes for 2 consecutive weeks will likely see results.